Hello everyone, hope you all are doing good. My name is Ananya Pal and on behalf of TriBeCa Care, I welcome you all to this discussion on COVID-19 Omicron alert with Dr. Nirmalya Roychowdhury. Dr. Roychowdhury is MBBS, MD, Internal Medicine from Calcutta National Medical College and MPhil from Salt Lake City, Utah. For the past 20 years, he has worked as a critical care doctor and gained proficient skills and knowledge in various segments. Welcome, sir. Hope you are doing good.
Thank you. Good morning, everyone. So our topic of discussion today is the current Omicron infection, Omicron COVID-19 infection. I have been given a few questions which may be relevant to the discussion. So let's go one by one. So what is Omicron? Omicron is the name given to the current COVID-19 variant that is basically, causing infection all over the world. It is a variant just like all other variants that we have seen for COVID. The first COVID infection that started back in 2019, we called it Alpha, and ever since then, WHO has conferred Greek alphabet names to the different variants that has showed up in the population. These variants happen because of mutations. COVID-19 is a coronavirus, as all of you know. Coronaviruses are RNA viruses. So when viruses multiply, they can have mutations in their genome. So that mutation will change the virus structure, virus composition to some extent. Whenever you have a mutation, a particular amino acid may change. You may have multiple mutations causing multiple amino acids to change. Basically, what happens is that a virus is made up of proteins. So when you have mutations, some of these proteins can change, giving different characteristics to the virus. So some of the variants have been very, insignificant. We don't hear their names that much. They were found in very localized populations. For instance, the Sigma variant and a lot of other variants where we don't hear the names. And there were variants which were very infectious, became global concerns, infecting millions of people all over the world, like the Delta variant. So those names become more popular. So basically, instead of using the word variant, we can also use the word mutant. So these are all different mutants. So current Omicron infection that we are saying, it is basically a mutant coronavirus. Now, what is the severity of infection? Luckily, this current Omicron variant of COVID does not cause very serious infection, usually, if you are vaccinated. In most cases where people had any serious illness because of this infection, because of Omicron COVID-19 infection, these people were not vaccinated. So if people are vaccinated, we usually get mild infections. Those symptoms vary from just mild fever, cough, runny nose, pain in your throat, difficulty swallowing, and sometimes a hacking cough, non-productive cough. These are the usual symptoms of the Omicron variant of COVID. There are people who sometimes can progress to bronchitis and some other lower respiratory infections But usually from Omicron, we get upper respiratory tract infection, unlike the previous COVID variants like Delta and Alpha, where you had lung involvements. In Omicron, we usually don't see lung involvement. So that is a good news. That's actually very good that people don't get seriously sick from this infection. But the other side of Omicron is that it is very, very contagious. That means it can attach itself very effectively to human tissue through a particular receptor called the S2 receptor. So that is rather the downside of the Omicron infection. Downside in the sense that if someone gets Omicron infection, everyone else around him will get it. If you live in an apartment, you live in a high-rise building, if there are 3-4 people who got infected, you will see a lot of others are getting infected within a very short period of time. That is because Omicron is extremely contagious. Sometimes, there's no consensus on this, but it is said that it is about 10 times more contagious than the Delta variant. Something good about that, when so many people get infected, there is a possibility that everyone around us develops some degree of immunity from the infection, irrespective of the fact whether they were vaccinated or not. There may be a very pertinent question here that a lot of people who got vaccinated, why should they get COVID infection at all? The whole problem here is that the vaccines were designed based on the initial COVID infections, right? Or based on what we started having back in 2019 and 2020. Now, the virus, because of mutations, keep changing, as I explained earlier. So now this virus, for instance, Omicron, is a very good example where you can call this an immune escape variant. What it means is that the immunity that you have got from the initial infection or from the vaccines, that immunity can be not effective against Omicron, at least not entirely, because certain changes in the structure of the Omicron virus, or rather the Omicron variant, that eludes your immune system. So your immune system does not recognize the Omicron variant as a COVID virus. Not entirely though, because what we see that if you are vaccinated, the severity of infection is usually very mild. So that means that your immunity does work. Your immunity that you get from the vaccines does work, but not entirely. That's why you get some degree of infection. For some people, it can be very mild. A lot of people are completely asymptomatic. They don't even know that they got the infection. And there are some other people who can be quite sick, who got a cough and cold and runny nose and fever, headache. A very common symptom is generalized body pain, muscle aches, myalgia. That's what we say scientifically. So this muscle pain and body aches, this can continue for quite a few days. None of these are life-threatening. That's the good news. But because it is an immune escape variant, even if you are immunized with vaccines, there is a possibility that you will still get this Omicron infection. Regarding isolation protocols are the same. If you have the infection, you should wear a mask, even at home, so that others around you don't catch the infection. Otherwise, people should wear a mask outdoors. Wash your hands frequently. Washing your hands with soap, any kind of soap that will destroy the virus, whatever you have on your hands. If you don't have the opportunity of using a soap and water, you can use alcohol-based hand sanitizers. So these are very standard, prevention methods and isolation techniques that we have been using for the last couple of years. But in case of Omicron, so far isolation and prevention techniques, usage of masks and sanitizers are concerned, in case of Omicron, you have to be twice more careful because it is so contagious that chances of getting an infection is way more than Delta. Slowly, what we are seeing is that we did have Delta infections in the community too, even say a month back, but Omicron being so contagious that today most of the people getting COVID-19 are from Omicron variant. And that is again a very good news that Omicron is pushing Delta out of the population. Delta is the dangerous variant that involves your lungs and gives you a very severe lung disease. We don't want that to be present, and Omicron can be called a God's gift, that Omicron being so contagious that it is becoming the predominant variant of COVID virus in the population. So from now on, most of the times, if not all the time, when people get COVID infection, it will be from the Omicron variant. Now, you may say this is a little premature to say because we don't know if in next few months there are more mutations and then we have a new variant, which may be, as contagious as Omicron and maybe more dangerous than Omicron. We don't know. We don't know what's coming in future, if anything at all. This is a matter of time. We have to wait and see. At least for 6 months to a year, we have to wait to see if there is anything new coming out of this Omicron variant. I'm pretty sure there will be mutations. We will have new variants, scientifically speaking, but that is not my concern. My concern is that those new variants, if they are same as Omicron or they are more dangerous. If there are more, dangerous variants coming in future, then definitely that will be a very serious concern. But right now, predominant variant being the Omicron variant, it is very lucky for us that it is not really any serious infection, particularly for vaccinated individuals. This is like a common cold and cough. You will get some fever, body aches, runny nose, a dry cough, and some very basic supportive medicines like vitamin C, vitamin D, multivitamins, a little bit of gargling. You may take some steam inhalation, and that will help you, and your system, your body will take care of the virus in a short period of time. So these are the elements of the symptoms and prevention and isolation from this virus. Regarding vaccines, as you know, we have multiple vaccines for COVID-19. Moderna and Pfizer, these are mRNA-based vaccines that the mRNA is injected into your system, and that mRNA then eventually leads to production of proteins. These are viral proteins. Your body recognizes them as foreign proteins, and just like for any other foreign protein, your body will generate immune response, antibodies, and that's how you get immunity against the virus. But these mRNA vaccines are not available in India as of yet. In India, we have Covishield, which is also a very effective vaccine. And we have Sputnik. This was developed in Russia. That also is an average vaccine. And then we have Covaxin, which also has been found to be very good. Covaxin is a vaccine based somewhat on a time-tested model of how vaccines are made. Unlike Moderna and Pfizer, which are very new techniques, these are the first mRNA vaccines that we are using. On the other hand, Covaxin is designed in a very old time-tested platform. There are some scientific thoughts in this regard that Covaxin, what we are seeing right now, it seems that is giving the best protection against Omicron because of a reason that is called cell-mediated immunity. Because of how the vaccine is designed, you are likely to get better cell-mediated immunity, T-cell mediated immunity from Covaxin. But these are all topics of discussion. These are debatable topics based on very detailed immunology and virology. Let's not get into those details. But all the vaccines that we have in India right now, they are all quite effective. Covishield, Covaxin, Sputnik. But as I mentioned to you, that in case of an immune escape variant, for instance, this Omicron variant, it will elude your immune system, no matter what vaccine you take. Maybe for some reason, one may be little better than the other. Say Covaxin may be little better than Covishield or Sputnik. But at the end of the day, a lot of people, even who had Covaxin, they may have the same infection just like others. The good news, as I mentioned earlier, is that the infection is likely to be not very severe. Now, regarding booster, and I'm quite sure that is a very important question that a lot of senior citizens and healthcare workers may have in their mind. A booster vaccination is basically given as an extra dose of vaccine to enhance your immune response to the COVID virus. Right now, we are using the same vaccines that we have for booster. Now, down the line, maybe 6 months from now, from some scientific news is that we will have a different vaccine, which may be Omicron specific. So it may so happen that 6 months later or 1 year later, people will need another booster, which is directed towards Omicron specifically. Current booster dose is basically a third dose of the current vaccines that we have. People may say, do I have to take the same vaccine that I took for the first and second dose? I don't think that is necessarily true. If you had Covishield for the first and second dose, you can have Covaxin as the booster and vice versa. There's some scientific data suggesting that Covaxin may be a better choice as the booster compared to Covishield. But again, these are very intricate details that even scientists are debating on. So even if you have the same Covishield as booster, I think you should go for it, because what it is doing is it is enhancing your immune response or potential immune response in case you get an infection in future. Now, another important question someone may ask is that if I get Omicron infection, and a lot of people have got Omicron infection. A lot of people have got tested and they know that they got the infection. A lot of people, they didn't get tested because the symptoms were so mild. They just stayed at home, uh, take rest for a few days, have some basic medicines, and they are all, better now. So if you had an Omicron infection, that infection itself is basically a booster for you. So maybe not a bad idea to postpone the booster dose at least for a month or month and a half. There is no reason to be scared about it. Even if you had an infection and you go for your booster dose now, it won't really harm you. What I'm trying to say is that it may not be necessary right now. You may postpone it for a month or two and then get the booster so that your immune enhancement that you get from the booster dosing, that lingers for a little longer time. But again, we don't know what kind of immunity we are going to get either from the natural infection or from the booster dosing. We don't know people who got vaccinated, for how long they are protected. These are questions only time can tell. It may so happen that Omicron becomes so predominant and so prevalent in the society that people develop a herd immunity. So most people, even if they catch the infection, their immune system destroys the virus. The virus doesn't, get a chance to go from one person to another easily. And that's how herd immunity works. That's immunity for a lot of people, like a whole population. Saying that, we can imagine Omicron or COVID-19 as a whole, most likely the Omicron variant, this is not going to just go away. It may just stay in the human population, just like influenza. We had similar epidemics and pandemics of influenza 100 years back. That does not mean influenza has disappeared. Just like influenza, COVID is going to just stay in our textbooks and stay in the population for next many years. Once in a while, someone may present to a doctor with COVID-19 infection. As a matter of fact, from now on, whenever people come to us with, cough, runny nose, fever, body aches, we doctors have to consider possibility of COVID infection, and we will test them for that. But the good thing is that most likely this pandemic is basically an epidemic happening in multiple places across the world. That is called a pandemic. What is an epidemic? Epidemic is an infection which is happening to a lot of people, much more than what it usually does. So we have epidemics of corona infection in multiple places all over the world for the last 2 years. That's why we call it a pandemic. There is a possibility that with this Omicron variant infection, this pandemic may be coming to an end. Within a month or so, it may so happen that our government say that we don't need to wear masks, or unless we personally want to. A lot of restrictions may just disappear, and we may just go back to normal life that we had prior to March 2020, say in India, before our first lockdown. The normal life people used to have, it may so happen that from March 2022, we will go back to that same life. That does not mean COVID will disappear. You can still have COVID infection, maybe Omicron or maybe some future variant. And whenever you get symptoms of catching a cold or anything like that, you go to the doctor, and most likely your doctor will test you for COVID along with other tests. The next question that I was presented with is about reinfection. Yes, you can have reinfection. A lot of people who had COVID infection in the past, they presented to us with Omicron infection or like the current infection that is going on. So as I told you, the virus keeps changing. So it may so happen that you catch an infection despite the fact that you had an infection in the past, just like influenza. Influenza virus changes itself very frequently. That's why influenza vaccination, though we recommend it every year, especially for elderly people, it does give you some immunity, but it may so happen that you catch influenza despite having vaccinated. And why so? It's because the influenza virus, just like COVID virus, it is also an RNA virus and it mutates very frequently, changing a lot of its characteristics. And that's why your immunity from a previous influenza infection or from a, an influenza vaccine, which was designed based on previous influenza virus, that may not be effective. So, in my opinion, apart from the pandemic, which is, as I explained, like a global epidemic, apart from that fact, if that goes away and within a month time we are back to normal life, we should imagine COVID-19 as a very analogous infection to influenza. Just like influenza, COVID also mutates frequently, and it's very likely it is going to change over time. That does not apply to all RNA viruses or say all viruses. For instance, I will give you an example. Polio virus. Polio virus doesn't mutate that often. That is also an RNA virus. So imagine polio vaccine that was designed back in 1950s, it is still effective. 70 years almost, 65 years later, we are still using the same vaccine. So there are some viruses which does not mutate frequently, or the vaccines are so robust that the same vaccine can be used for decades. And polio vaccine is a good example. On the contrary, there are viruses like, say, the influenza virus, which keeps changing itself. And then the vaccine also has to be changed almost every year. That is exactly what I expect out of COVID. We're probably going to have future variants, changes in the COVID genome, and we may need to have new vaccines developed in future, and people may need to take yearly or biannually a new vaccine booster. So this is all in future. We have to act based on what we see, based on what COVID does. Last point here is about presentation. And this is something that I have already discussed, that how COVID patients present. The current variant, the Omicron variant, being a mild variant involving your upper respiratory tract, that is involving your sinuses, your nose, your pharynx, your larynx, most people present with body aches, fever, runny nose, cough, these kind of symptoms. Now, remember, if you have COPD, you always run the risk of having a COPD exacerbation from a respiratory viral infection. So whenever you get these symptoms, at least nowadays, having cough and cold and runny nose, these are basic, cold symptoms we used to get frequently during the winter months, and no one really bothered about them much. People knew that I will take some paracetamol and some antihistaminics, and I will be okay in 2-3 days. Take some rest, have some soup and juice and stuff like that. But right now, if you are elderly, if you have COPD, if you have any kind of lung disease, asthma, or anything that involves your lung, As even for heart patients, people who had coronary artery disease, people who have heart failure, all these kind of people should take these kind of symptoms a little more seriously from now on. Because anytime you have a runny nose, cough and cold and fever, it may be a COVID infection. And in case of any respiratory viral infection, you can have respiratory or say cardiovascular symptoms worsen a little bit. I have seen a lot of patients who present with worsening asthma because of COVID infection. COPD can go into exacerbation. Sometimes when you get a respiratory infection, it can also lead to heart failure or worsening of heart failure. Your heart and lungs work as one unit. So anytime you have a stress on the lung, it also causes a stress on your heart. People who have heart diseases, that can worsen, especially heart failure can precipitate because of viral infection or any kind of infection in your lung. One other thing is, say, any kind of viral infection in your lung can predispose you to a secondary lung infection, which is usually bacterial. That means if you catch a COVID infection or influenza infection, you may also get a bacterial pneumonia. A lot of people have viral infection to start with, and then after maybe a week or so, they develop a pneumonia in their lung. Pneumonia is a very serious disease, one of the commonest killing diseases for elderly people. Most people who are aged, say 80 years, 90 years old, or even younger, most people, they, apart from dying from heart attack, stroke, and occasionally maybe cancers, the common disease that kills most of these people is pneumonia. And so pneumonia is a very serious potential complication of respiratory viral infections like COVID. One thing that I recommend to my patients is pneumonia vaccination. Uh, Pneumonia is a very preventable disease with modern vaccines. Um, there are a couple of vaccines for pneumonia which are quite effective, and they cover pneumonia quite broadly. That does not mean that you cannot get a pneumonia. There are a lot of different kinds of pneumonias that these vaccines won't cover, but on an average, the common kind of pneumonia that you get from streptococcal infection, those are covered very well by these vaccines. So I really recommend people with lung disease or people who are elderly to go for pneumonia vaccination. From this COVID pandemic that's going on, I think they should become even more sincere and serious about getting vaccinated for pneumonia. Pneumonia vaccination is not something that you need every year, unlike influenza vaccine. Pneumonia vaccine, you say Prevnar, you need only once in your life. Other vaccine, that's the older one, the pneumovax vaccine, that you need to repeat. You need a repeat dose after 5 years or 10 years, depending on your age and your comorbidities. So these are not anything difficult. These are things that can be done easily, and you don't need to, do this every year or anything frequently. You do it once and you are done. And in the other case, you are okay for at least 5 years, if not longer. So these are things that we need to remember. It's not just COVID, but also what other problems COVID can lead to. And in case of elderly people, I would recommend that if you catch an infection that suggests you or gives you the impression of possible COVID infection, like cough and cold, runny nose, throat pain, anything like that, please don't take it lightly. Please at least get tested for COVID, because if it is COVID or influenza, then you can have some potential complications. We don't use this very frequently, at least in India, but I practiced in the Western world for 18 years. I was in the United States for about 18 years. And even there, we don't use this that frequently, but there is a tool called BioFire. This is available in sophisticated hospitals here as well. Whenever you catch a respiratory infection, we can do a BioFire testing and give you the exact virus that you may be infected with. So if you ask me what is the right thing to do for elderly people, I would say test for COVID and also do a BioFire. That will give you exactly what infection you have. In case of BioFire, you have a battery of tests, basically, depending on your presentation, whether it's upper respiratory or lower respiratory. We check for multiple viruses, not one virus, but multiple viruses that usually cause symptoms. Among them, influenza is an important one, or rather the most important one. And currently, obviously, COVID is another important one. BioFire does not cover COVID-19. So for COVID-19, you have to do a separate real-time PCR that we have been doing. This is what I would, share with you in a nutshell about what COVID-19 is and what the presentations are and what to expect in future and potentially how to avoid getting infected. I would be more than happy to answer any questions that you may have.
Thank you so much, sir, for guiding us against this highly contagious Omicron virus. I'm sure our audience are highly benefited from this. As Dr. Roychowdhury said, we should not panic, but yes, we should be alert. Follow the appropriate COVID protocols, and yes, get ourselves vaccinated. Thank you, sir, and thank you once again from Team TriBeCa. And remember, if you need any help, we are just a call away. Stay safe and stay healthy. Thank you.
Thank you.